How does employer health coverage affect Medicare enrollment past 65? Imagine you're turning 65 and still working. You might wonder how your job-based health insurance fits with Medicare. Well, your employer coverage can change when you become eligible for Medicare. If your employer has 20 or more employees, Medicare usually becomes secondary. That means your employer plan pays first, and Medicare pays second. You can delay enrolling in Medicare Part B without penalties as long as your employer coverage is credible. But if your employer has fewer than 20 employees, Medicare is the primary payer once you turn 65. You need to sign up for Medicare Part B to avoid gaps in coverage or penalties. Now, you might be thinking about delaying Medicare because your employer plan covers most health needs. That can be fine, but you should check if your employer's plan is considered credible coverage. If it is, you can hold off on enrolling in Part B without worry. When you lose your employer coverage or retire, you get an 8-month window called a Special Enrollment Period. During this time, you can sign up for Medicare Part B without facing late penalties. If you decide to keep your employer health insurance, it's often a good idea to enroll in Medicare Part A. Part A covers hospital stays and is usually free if you've worked and paid Medicare taxes for at least 10 years. Having Part A can help cover hospital costs even if your employer plan is primary. To avoid penalties, make sure you enroll during your special enrollment period or when you first become eligible. Working past 65 adds some flexibility. You can delay Medicare Part B if your employer coverage is good, but it's important to understand how your employer plan works with Medicare. Some plans may have restrictions or costs that make enrolling in Medicare beneficial. Others might be enough on their own. In short, your employer health coverage can influence when and how you enroll in Medicare after 65. If you work for a large employer, you might delay Part B, but you should stay aware of your coverage details. If your employer has fewer than 20 employees, enrolling in Medicare Part B becomes more urgent to prevent gaps. Knowing these rules helps you make smart choices about your health insurance as you continue working.